All right, so we're talking about knee arthritis. So what does the word arthritis mean? Well, first of all, by a show of hands, who has arthritis? Who's been told they have arthritis? So easily the majority of the folks here. So if you actually break down what the word means, the word arthros, or A-R-T-H, actually means joint, okay? And I would assume that's probably a Greek term. And then the I-T-I-S is inflammation. So on a very general basis, it means inflammation of a joint. So anytime the word or the letters I-T-I-S are at the end of any word, it means inflammation of. So appendicitis, inflammation of your appendix; tonsillitis, inflammation of your tonsils. So arthritis, inflammation of your joint, okay? So arthritis is a very generic term. It's not like you either have it or don't have it. It's sort of a spectrum. You can have mild arthritis, you can have severe arthritis, okay? Anywhere in your body where there's a joint, you can have arthritis, okay? So I'm going to use the term white shiny stuff when we talk about arthritis. Arthritis affects cartilage. It affects articular cartilage. Well, I don't like saying articular cartilage, so we're going to call it the white shiny stuff, okay? So the white shiny stuff in your knee, that's the cartilage, that's what arthritis affects. So I use the analogy, if you take a chicken leg and like the drumstick and pop it off, you're looking at that little crystal ball, you see at the end of the chicken leg, that's that white shiny glistening smooth stuff, that's cartilage. That's the white shiny stuff I'm talking about. We have that same stuff, okay? If you take a fork and scrape up that white shiny stuff, that's arthritis, okay? So just so kind of we're talking in the same terms. That's what I mean when we're talking about arthritis, okay? This is a surgical picture of someone's knee, okay? And so again, this white stuff you see, that's the white shiny stuff that I'm talking about, okay? My point in showing this picture and showing the next picture is to show you what arthritis looks like to us when we're doing surgery. This is nice, white, shiny, and smooth. That's good, healthy, white, shiny stuff, good, healthy cartilage, okay? So if we look at these pictures here, all right, so this looks like, like a little mop or peach fuzz hanging off, okay? That's arthritis. That's the beginnings of inflammation of the cartilage, okay? So you look at this picture here, this is bone. This is your cartilage. So this is an area in someone's knee that has eroded through all of the cartilage, and you're down to raw bone. So you've heard people say, oh, I've got bone grinding on bone. Well, that's what we have no more of the white shiny stuff. It's eroded all the way down to bone, and you can imagine if you have bone rubbing on bone, that's going to hurt like crazy, okay? So what is arthritis? Well, you always talk about the creaky joints you feel. It kind of takes a while to get going in the morning. So again, arthritis is a generic term. There's different kinds of arthritis. The most common kind is osteoarthritis. People call it wear and tear arthritis, arthritis of age, DJD, degenerative joint disease, and then you hear the term old Arthur. Old Arthur's getting me. All right. There's rheumatoid arthritis, okay? Rheumatoid arthritis, we don't see as much anymore from a surgical perspective because there have been a lot of advances in medications for rheumatoid arthritis, and the medications that have been found nowadays are really helping alleviate the pain from rheumatoid arthritis. So, but that is a kind of arthritis, all right? There's post-traumatic arthritis. What is that? Well, someone breaks a bone, breaks a bone into a joint, that affects the cartilage, okay? So that's post-traumatic arthritis, all right? Post-infectious, don't see that a lot. There's other kinds of arthritis. There's neuropathic patients who have diabetes can get neuropathic joints and can get arthritic pain from that. Things like lupus, things like gout, okay? Now, we're going to be talking about osteoarthritis during the rest of this talk, okay? But just to understand, it's, there's different kinds of arthritis, the most common one being osteoarthritis, okay? So let's look at some x-rays here, okay? And again, I'm not so much worried about the technical aspect of it, but you're going to see a progression of x-rays. People come to my office and say, all right, I tell them you have knee arthritis. They say, well, is it ever going to go away? So my answer to the question is the arthritis you have will either stay the same or will get worse, okay? However, what we do, we try to control the symptoms. So if we can control the symptoms, which are pain and stiffness, we'll talk about that, then we kind of, that's the goal of treatment, okay? And the goal of treatment also is to avoid surgery if we have to, okay? So this is an x-ray that I take in my office when you're standing up with your weight going through your knee, okay? This space between these two bones is made up of the white shiny stuff, okay? You don't see the white shiny stuff on x-ray, okay? You see a space, so we always talk about the joint space, okay? So let's just look at these x-rays I'm going to take, and again, it'll be pretty obvious, but so I say it's progressive. So look, so now you got bone touching bone here, okay? So the white shiny stuff is now eroded away. But so now you see bone touching bone, okay? That's like that picture I showed you where the cartilage had eroded down to raw bone, okay? Got bone grinding on bone. You know that's going to hurt every time you walk or stand up, okay? That's even worse. So now you're getting so much bone grinding on bone, you're starting to erode bone. You're starting to lose bone because you have no more white shiny stuff. Now the bone is just wearing out. It's like treads on a tire. The more miles you put on it, the more it's going to wear out, okay? The other thing is this patient is starting to turn bow-legged because what's happening is the cartilage on the inside of the knees here is wearing out, so they're starting to kind of go like this. I use an analogy of wheels on a tire. I mean, treads on a tire. You know, I just said that you know, wearing out your cartilage is like wearing out the treads on a tire. Now, think about a car where the wheels are not in alignment. They're turned out like this or turned in like this, and you're driving across country. It's the alignment's off of the tires. It's going to wear out the cartilage or the treads even more. Same thing here. If you start getting bow-legged or knock-kneed with arthritis, it's going to wear it out even more, okay? So very significant arthritis in that last picture here. And ultimately, for that patient, we had to do a knee replacement surgery on him. There was no way to control the symptoms after we tried everything, so we did knee replacement. We got rid of all the arthritis, put in some metal with a piece of plastic in the middle, okay? It solved their problem, but it was a big surgery, but very successful. So, you know, the goal of our treatment is to avoid surgery if at all possible. I'm going to show the same series of x-rays with a hip, okay? And again, we're not going to talk much about the hip, but you can see this first x-ray, you know, nice round ball and socket here. You can start seeing, starting to get thinner, it's starting to erode away. And the next two pictures will kind of show you how it's eroding even more. You can hardly even see the ball anymore. The ball has eroded through all the cartilage. Now you're starting to get bone loss, okay? That's starting to be concerning. You know that's going to hurt every time they walk on it. Now you can't even see the ball anymore. The ball is completely eroded off, okay? This is a very extreme case. Most people are, will have come seen us before then and would have had surgery before this, but this is an extreme case. Just sometimes a picture's worth 1,000 words, and then ultimately this had to be done, and hip replacement, and the patient did great, okay? So the good news is for very bad arthritis, we have a very good answer, but it's surgery. So again, we try to do everything first before surgery to help control the symptoms. And we're going to talk about that. What is it, the stuff that we can do before surgery to help decrease the symptoms of arthritis, okay? Why do we talk about arthritis? Well, you know, why don't we talk about cancer or heart disease or diabetes? Well, arthritis actually is the #1 cause of disability in America, okay? So whether it's work-related disability or whatever, but if you look at the Medicare database, arthritis is the #1 cause of disability in America, so it is a very big problem. That's not to discount any of these other, you know, the heart disease and the cancers. We're not talking about, you know, mortality rates necessarily. We're talking about disability, because arthritis is not terminal arthritis. It's something you can live with, okay? So that's why it's the #1 cause of disability in America. So another important statistic is more than 80% of people over the age of 60 have evidence of arthritis on x-ray. Doesn't mean they're having problems with it, okay? So these are patients who have x-rays. Some people may have arthritis and don't even know it because they're not having the symptoms yet. They've not progressed to the point where they're having symptoms, okay? So very, very, very common problem. So what are the symptoms? Pain, #1. Patients come into the office because they have pain, all right? My knee hurts, doc. Here's the deformity, you know, as arthritis progresses, you start getting some change in the shape of your leg. You know, it looks like you've been riding a horse for like 3 years. So you come in maybe a little bit bow-legged, okay? Or maybe come in a little bit knock-kneed, okay? And that's because you're wearing cartilage off in certain areas of your knee, all right? So, you know, we talk about alignment of your leg or deformity. That's another symptom, okay? Stiffness. You lose motion of a joint, okay? Sometimes it hurts to bend it real far back. Sometimes it hurts to straighten it all the way out. As your arthritis progresses, your stiffness can progress. But the #1 symptom that brings patients to see us is pain, okay? You start having, you can't even do the things you want to do. It hurts to go down to get the mail, you know? It can cause pain in the evening after a long day. You sit down finally and kind of relax, take the pressure off your knees, they start hurting you more. If you're in pain all day, you're not sleeping well, it can even cause depression. So, you know, all these things can emanate from a patient having knee arthritis. The interesting thing about arthritis, and it's not uncommon for a patient to come into my office saying, well, doc, you know, when I called your office a week ago, my knee was killing me. It ain't hurting me today. Not uncommon. So the symptoms wax and wane, they come and go, and that's just the nature. You have your good days, you have your bad days, and it kind of goes up and down, okay? And sometimes weather may flare it up. You may walk more than you normally do, it may flare it up. You may twist, just even mild may flare it up. You rest it for a couple days, it gets better, okay? Good days and bad days, okay? What we do know is without treatment of some sort, the symptoms are going to worsen over time if you don't do something about it, okay? So what are the risk factors? So now we start talking about what are the risk factors of anything, and then we determine what can we change or what can we treat to modify these risk factors to prevent arthritis from progressing. So age. Remember I told you wearing out the treads on a tire, okay? Genetics. We do know that there's some genetic component to osteoarthritis. We don't know exactly what it is, okay? We also know rheumatoid arthritis, there's a genetic predisposition, so you can blame your parents a little bit for arthritis, all right? The other thing we know is weight, okay? So think about, I'll go back to the tire analogy, think about having Volkswagen tires on an F-350, okay? A Volkswagen Bug on an F-350, okay? You can imagine how those tires will get worn out a lot quicker, okay? And we're going to talk a little bit more about that. Women actually get arthritis more than men. We're not really sure why, but women have a higher incidence of osteoarthritis than men. Lack of exercise. Lack of exercise will worsen the symptoms, okay? I know you guys have an arthritis exercise program. I encourage you guys to do that because the exercise can help keep your limbs limber, keep the knee limber, keep the stiffness out. It helps decrease some swelling. It can help with decreasing the pain as well. So I like this picture here. So I don't know if you guys can read that, but this guy's got a t-shirt saying I beat anorexia. So the issue is what can we control? What can we do of these risk factors? What can we do? What can we treat? What can we modify that may prevent progression of symptoms? Well, we can't change age or genetics. We can change weight. We can change your exercise regimen. So we'll talk a little bit about that. All right. So overweight, lack of exercise. These are the things that we can modify and maybe eliminate some of the symptoms of arthritis. So, all right. So what are the treatment options? Okay. You come in. You got arthritis. I took an X-ray. It shows bone grinding on bone. You're having pain, you're having stiffness, you've not tried any treatments. You say, Doc, what can I do? All right, well, there is a long list, and we're going to go through these pretty quickly and talk about all the different options to treat your arthritis. And we're going to start very conservative. We always start with conservative measures. And as we try these, they don't work, we move on up to the top of the pyramid where we've got to talk surgery, like those joint replacements that I showed you in the picture a few slides ago.